everyone. Thank you so much for joining us today. If you are able to join us for part 1, where Leah Davidson, she really invited us to just kind of think about our own experience and the parents' experience during those times when we're sharing difficult information with them. So today, what we're going to do is something a little bit different than our normal Talks on Tuesday, and we are going to host a panel-type discussion with lots of different perspectives in the room, well, online room. So let's go ahead and kind of meet our presenters. So we have, let me grab my little pointer. So we have Leah Davidson. She is a local system manager in Arlington. Jessica Bricky, she is a licensed clinical social worker. She also serves as an autism clinic team facilitator in Henrico, where they assess children in early intervention for autism. Next we have, Casey. And Casey is a service coordinator and a developmental service provider in the Infant and Toddler Connection of Harrisonburg and Rockingham. And next we have Joshua Capehart, who has been a service coordinator for over 10 years with the Infant and Toddler Connection in Norfolk. And finally, we have Katie Webb, and we're so excited that she is joining us to really share the parent perspective today. And I'm going to kind of let you, Katie, just kind of share your story.
Hello, everybody. Thanks for having me. I am a mother of 2 boys. One is 6 and almost 7. I know that makes a big difference. And the other one is 4 years old. And unbeknownst to my husband and I, he was born with a chromosomal abnormality in 2014. He was also a NICU graduate. So we found out in the NICU that maybe he had a chromosomal abnormality. They didn't really know what it was. And then it wasn't until he was discharged from the hospital a couple months later that we went to VCU and spoke with some geneticists and realized that he was the only one in the world with this specific translocation. So since then, I kind of knew where the challenges were in the system, and I wanted to get back. And so I loved working with new families and being a support system to new families that were just going down this new journey and road of having a child with a disability. And that's what brought me to the New Path Family Support Coordinator at the ARC of Virginia.
Thank you, Katie, so much. So what I want to do next is go ahead and kind of do a quick recap of part 1. So Leah, if you don't mind just kind of recapping some of the tips and things that you covered in the part 1 of sharing difficult information.
Sure, I'd be happy to. So in part 1, we spent the hour thinking about the difference between managing our own emotions and our own reactions when we have to share difficult information with families, and worrying about families' reactions. And so one of the big take-home points was keeping those 2 things separate, kind of staying in our lane. Like, we cannot control the stress or the feelings or the reactions of the families we're talking to. We can only manage our own, and the reason we want to manage our own is because I know that everybody listening to this webinar right now wants to be their most compassionate, most helpful, and most present person when they are delivering difficult information, any information really, but particularly difficult information, when we do tend to be at higher risk for being more stressed. Both we are at higher risk, and of course the family is maybe going to experience some more stress. So we were tasked with figuring out some ways that we could manage our own stress, and some things that we talked about were self-talk. So not out loud, even though that would be always my preference as an extrovert. I always love to say things out loud. However, when I'm with someone else and trying to manage myself, I got to keep it in. So using your own mind and your own ability to calm yourself down, reminding yourself nothing has to finish today, because usually that's true, right? We see people on an ongoing basis, or we hand them off to somebody who hopefully will be equally as compassionate and kind. So not everything has to finish today. It's not all on me. I have the skills to support this family, and I'm going to be here no matter what their reaction is. I'm going to support them no matter how they're feeling. And just kind of reminding yourself that their stress and anxiety does not have to trigger your stress or anxiety. You can be calm even if they are not. So we talked a whole lot about that. And we also talked a little bit about the fact that parents' words will not always match their feelings. So if we're delivering difficult information and somebody is saying, yeah, okay, I get it, what they might be feeling inside is, oh my gosh, this is so scary, stressful, disappointing, irritating, I don't agree, I'm irritated that this person thinks this. All those things might be coming up, and we just need to be present so that those things can bubble to the surface if they need to, and that we can send a message to that family that no matter what you are feeling or what your reaction is, I am steady and I'm here, and my only goal is to be a source of help, not a source of stress. So that's kind of what we talked about in this first webinar, and I appreciate getting the chance to get to sit and think about that with you all.
Thanks, Leah. So raise your hand if you were able to watch the webinar. So you're going to use your raise your hand feature under the participant box and click the third icon, which is a little hand you'll see. So go ahead and click that. And for those who were not able to watch it, I'm not sure if you are aware, but all of our Talks on Tuesdays are archived, and I'm going to post the link in there. Oh, thank you, Janie. So Janie just posted the link in the chat box that you can access. So if you'd like to take a look at that, feel free to access that. So what we're going to do today is kind of talk about how we're sharing information throughout the early intervention process, because we know that there's multiple times throughout the process where we can kind of find ourselves that it's time for us to share difficult information with families, really for them to kind of make some type of informed decision as well about their child. So if you see on the screen, you'll see the different processes that we're going to kind of cover today. But I want to invite you to drop a pointer on which process you find the hardest to share information with families. And you're going to access your pointer, that's the vertical toolbar to the right at the participant box or your chat box, and you're going to click the second down, and it could be a little starburst, could be a hand. So go ahead and click that and drop a pointer on which process you find may be the hardest to share information. So let's see, we have assessment for service planning and IFSP development, ongoing assessment. Yeah, and I would probably say, for me, it's always that initial assessment for service planning and IFSP development, too, because there's a lot of different processes. So it looks like that's where most people find it, ongoing assessment, eligibility determination, assessment for eligibility, and all of those processes in itself, they really have their own characteristics and reasons why it could be difficult to share information. So let's go through each of those processes, and I'm going to really kind of lean towards our panel and kind of talk to them about just some of their experiences that they've felt during this time. So let's start with referral. So this is really the process where we're beginning to inform, prepare, really check for understanding, give parents an opportunity to ask questions, or maybe we can answer some questions for them. And we might not always think of referral as a difficult point in the process to share information, but a lot of parents, when they're first coming to us, they may be feeling apprehensive, or depending on the reason for the referral, they may already be feeling judged. So Leah, as a local system manager, how might the information that we share at referral impact the family, and how do you support them on the phone call?
Sure. I think that the first phone call is a wonderful opportunity to do something that I like to call reach out. So when somebody is being brave enough to call an agency because someone has let them know that there might be something atypical or delayed about the development of their child, I think that it is incumbent upon us to send the message that we are happy that they called the right place, that we're going to help them, that our kind of personality as an organization is one of helpfulness and curiosity, and that we're invitational, that we want them to come to us. And I think that this is an easy opportunity to miss because I talk on the phone like all day, right? And so when I am fortunate enough to have a referral phone call come directly to me, I have to do my own work to change my mindset. That's a different kind of call than a colleague calling me, or some sort of procedural phone call that I might be taking. That is a person who has to be vulnerable, who is on the other line or on the other end of that phone, and who I think is really important for me to convey a supportive message to. So when I answer a call, I try to, and when I say try, here's what I mean by that. If I'm at my best or my good enough state, that means that I'm able to take a deep breath before I answer the call, because I can look at the caller ID and see I don't recognize it. I assume any call that I don't recognize is a referral. So I usually will try to take a breath before answering, pick up and have my tone of voice give the message that I am so happy you called. I'm happy to talk to you, instead of what I might sometimes be feeling during the day with it, which is like, oh my gosh, let's just get this over with because I have a lot to do. So I try to not convey that reality, but to take a breath and convey, I'm so excited to invite you to learn about our program, and I can't wait to learn about your baby. So tone of voice is everything. It really is, too. I took a class a couple of years ago where I learned that only 7% of what people perceive actually comes from our words, the content of our words. Only 7%, that's so little. Everything else comes from body language and tone of voice. And when you're on the phone, you don't even have body language. People can't see you, so it's all in the tone of your voice. So I think I try to really keep my voice high, light, and invitational rather than low, stressed, and gravelly, right? I also, when I'm at my good enough state, if I'm not like extra tired or having something crazy happening, one of the things I try to do is read the cues of the person on the other end of the phone. So I'm listening to their tone of voice, and I'm trying to look at what style are they talking to me in. And if I can get a read on that, then I will modify the way I'm responding to them. So a couple of examples. If when I'm answering the phone and I hear a parent talk to me and they're asking me a lot of questions, maybe they want to know why we do things a certain way, or they just have lots of kind of logic-based questions, my gut reaction might be, oh, why are they interrogating me? But I override that, and I instead have a second thought that is, oh, if logic and data are important to them, so that's what I'm going to offer. So I may then spend a little time giving them some of the logic or the why behind, why do we come to the home versus we bring you here? Why do we look at the whole of development rather than just the area of concern? What's the research? Are we private or are we public? Let's talk about the fact that we're funded from a couple of different sources, and that we are, everybody has a right to an eligibility determination, these kinds of things. So I will give information that responds to the thing I'm reading. If I read it wrong, generally they'll correct me. Generally I'll hear that it's not quite meeting their needs, so I'll change course. Are they wanting me to just get to the point? So if I have somebody on the line that just wants to know what to do next, I will keep things short. I will talk about actions. So someone will call you within 2 days. We will do X, Y, and Z, come do an intake and an assessment for service planning. I will talk a lot about the actions that are going to happen. If somebody is showing me some emotion, so if someone is saying, this is really I'm a little nervous about this. I hope I'm calling the right place. My doctor mentioned something about his development that I didn't know before. Any kind of sort of emotive talk. They're showing sadness, they're showing anxiety, they're talking about those emotions, then I'm going to do a lot of validating. Oh, I know this can be a hard call to make. It's hard for a lot of parents, and I'm so happy that you called because I just know that we can help you. I just know we can help support you through this process of discovery about your child. So if I'm hearing a lot of emotion, I will hold those emotions. I will respond by validating those. Are they asking me questions about what the rules are of the program? So am I getting a lot of like, well, what do I need to have prepared? Do you need me to send his doctor's orders right now? Do you need anything from the doctor? What should I have with me at the intake? You told me you'd come to the house. Then I'm going to stick to what they need to do, because for that person, that might be a person where their own preparedness is really important to them. What they want to know what to do and how to plan. So then I'm going to help meet that need. And I think just that kind of mindset on the initial referral call can be really impactful for families, because it sets a precedent that everybody in the early intervention system is going to be responsive in that way. So those are just some of the tips that I try to use when I'm on a referral call. And works pretty good.
Thanks, Leah. So let's kind of bring in Katie's perspective. Katie, so as a parent, like when you made that first initial call, how did you feel?
I think I was pretty nervous because this was all uncharted territory for me, and I didn't really know what to expect. Of course, I was hopeful that, well, he may not need services for that long. I don't think he doesn't really have a disability because he's such a small little baby, and there wasn't, to my knowledge as a parent, a lot going on developmentally, but I'm not a professional in the sense. So when I made the initial call and they told me I needed to come in, it was a little heartbreaking, but I love the fact that what Leah said best, she almost gives the family a virtual hug over the phone and makes them feel comfortable and is able to read the family so well based on what their needs, like if they're asking a lot of questions to know what kind of parent that is, or if they just need more support with other information, or if they want more resources, because it's definitely not an easy call to make.
Thanks, Katie. You have such a great perspective, so we really appreciate you sharing that with us. So let's go ahead and look at really just the next step in the process. So let's look at the intake, right? Because this can really be our first general impression when we're entering the home. So Casey, as a service coordinator, like how do you help make families feel a little bit more comfortable as you're kind of sharing information with them?
I think one of the biggest pieces is really making sure that you're holding these visits in an environment that's natural to them. So our program really works to meet either in the family's home, the daycare, the grandparents' home, and I even met a family at a local park that was comfortable for them. And another piece is really listening to the family. So oftentimes I'll hear, why is my child behind? Or did I do something wrong? What can I do to help them? And they're all questions that I feel really provide awesome insight to the feelings that the caregivers are having. And those feelings can range from guilt to sadness, frustration, to also what's motivating them. So not only is it important to listen to these questions, but really hear them and acknowledge them, and acknowledge both the feelings and concerns. Taking the time to respond to their questions directly, like Leah was saying, if they're data-driven, citing evidence that early intervention really makes that positive impact, and acknowledging the caregivers as the child's best teacher and saying that you're there to support them.
I love how you really said, too, like acknowledging the family's feelings and concerns, because they're important, right? How they're feeling is important, and we want to make sure that we're kind of like acknowledging that with them. Judge Sherlon, you shared with me a really great way to build relationships from the very beginning with families. Do you kind of mind sharing that with everyone?
Sure. So, we're going into families' homes, and it's very scary already to have someone new coming into your home, especially when it has to do with the care of your child. So I try to really make sure that I'm making the family comfortable. So I share a little bit about what my role is as a service coordinator, because I think that's very important for them to know what they can expect from me. And then I also share some information about myself, just some basic things, because I want them to understand that I'm a real person. So I'm not just someone coming into their home and gathering information about their family, but letting them know that I'm a real person as well. So I share just a little bit so they can be comfortable. And what I really love about what I do is I try to let them know that I am going to be a part of their family. I'm not just coming in to be nosy or to gather information, but that their child's development, their child's like who they are is really important to me as well, and I know it's important to them. So I really try to build that rapport with them from the beginning so that they're comfortable sharing information with me that I'll be able to share with the team so that we can ensure that their family gets the support that they need. So I think it's just really important to let them know that we're there to support them.
I love the sharing of information. That's so important. Katie, can you tell a difference when and how, I guess, a professional is really treating you? Like, can you tell a difference how they treat you differently?
Absolutely. I think is, like these ladies said, it's imperative to have the intake in an environment where the family feels comfortable. I unfortunately didn't have that option. I had to go into the office and have my son's intake, and I was extremely nervous because he was 42 days post NICU, or he was in the NICU 42 days, and so we graduated out. I was, it's January, February at that point. Cold flu season. He was medically fragile anyways. I didn't really know what to expect. I didn't really know what I was doing, like I said, and here I have this fragile child, and they want me to bring him into an office where there are a lot of other kids and risk him getting sick. And the last thing I wanted to do was go into the hospital again if he got an illness. So I wanted the best option for me and where I would have felt the most comfortable personally was in the home, but that wasn't an option for me at the time. I had to go into the office for the 2-hour assessment or the 2-hour intake. So I really love the fact that you're saying let's go to a place where the family or the parents feel the most comfortable, and having someone come in and sit on the floor and talk to us and, go over the whole process and how we're going to benefit from it and the importance of it would have been a complete game changer.
Thanks, Katie. I know before you kind of mentioned when we were talking that, like sometimes like you kind of struggled like with your own parental guilt that you're feeling, and we definitely get a sense of that. Like sometimes I definitely feel like I can sense that a lot of families are feeling that. So was there anything that really helped you kind of during that?
Honestly, you hear parents, every parent that has a child with, and I can only speak with a disability, there is a grieving process. There's a and if they say that there isn't, they're lying. Because you miss the child that would not have a disability. So now you're dealing with this child that has a disability. All these I's need to be dotted, all these T's need to be crossed, and it takes time to get over. But having somebody, like just listening to these ladies talk, it would have been so much easier for me, and just having them have a conversation and say, listen, you're going to get through it, we understand. Just listening as opposed to telling speaks volumes. Because you are sad. You're very sad.
Thanks. I appreciate that. Casey, so you had a story, because we do get those CPS calls and we get those substance exposure babies, those kind of referrals, and you had a great story like of how you helped the family kind of open up to as you were sharing information. Do you mind kind of telling us that really quickly?
Absolutely. So I had a CPS call where the family was referred. This little one had substance exposure to marijuana, and when I first called them, you could hear the mom's hesitancy in her voice. She was using very short answers, yes and no, but she did agree to an intake visit. And when I first arrived at the home, Mom answered the door, very quietly said, "Come in," and immediately walked away from me towards the kitchen. So I asked to follow her. She said yes, and she told me, "You sit at the table," while she stood up against the kitchen counter with her arms crossed. And the dad came out of his bedroom, and he also stood next to Mom with his arms crossed. And at this point, I was just realizing, now's not the time to take the paperwork out. So I left it in my bag so that I could really focus on what the parents were saying to me and build that relationship with them from the start. So I asked how having their third child at home was going, how the siblings were responding, and acknowledged that they seemed to be doing a really nice job of balancing all the responsibilities. And at that point, their arms slowly started to unfold. Mom picked up the baby and came and sat next to me at the table, and Dad moved his hands into his pockets and was just a little bit more relaxed. And throughout the visit, we were able to have a really genuine conversation about the strengths they saw with their little one, such as he was doing an awesome job with nursing and sleeping, and he was also starting to get excited when he was hearing family voices. We discussed why the baby was referred and why in early intervention we often have children who are referred for either alcohol or drug exposure, and what we sometimes see happen with these children's development. And I feel like I helped prepare them for what to expect, not only with their child, but with our process and our program. And I thought it was pretty neat. By the end of the visit, the dad looked at me. His hands were out of his pocket, and he was smiling. And he said, "This was nothing like what I was expecting. Everyone else has come in here and has always said what we've done wrong or how we've harmed our child. And I feel like you came in and you really just wanted to get to know us and support our family. Thank you." And so this family ended up not coming into our services, but I feel like if they had come in, we would have had a great relationship. The conversations would have been easy. There was a mutual respect in place, all because of that honesty and lack of judgment for why their child was referred, and just my statement that I was there to support their family.
Yeah, and not only that, it seems like you were already starting to build such a great rapport by just listening to the family and just showing an interest in that you genuinely cared about them as a family and their life and what was going on and how you could help support them. So thank you, Casey, for sharing that information with us. So the next process is eligibility determination or assessment for eligibility. So this can result sometimes in sharing information on why a child is determined eligible for services. So sometimes this may or may not always match a parent's concerns. So Casey, when you're looking at this, like how are you preparing for families for this discussion that you're about to have with them?
Definitely. So I personally find that it's really beneficial to prepare families from the intake, talking about what eligibility looks like, but also sharing the ASQ3 tool that our program uses, scoring it in the home, and sharing the chart on the back that shows where their skills are falling just based on that one tool. And I share I'm not the only one that can determine eligibility, but the tool and all of the valuable information that the family shares is important to that eligibility discussion. And I always ask the family, do you want to participate in our eligibility meeting?
Yeah, that's good. It sounds like you're kind of like sharing the information and letting them know like where their role is in the process too. And really you have a unique role because you're a dual role as a service coordinator and developmental services provider. So Joshua, you are a service coordinator only. So what would you like to add to this kind of experience?
So I think it's important that we let the family know exactly what we're doing during the eligibility determination process. And so I always explain each area of development to the family. I let them know how those areas of development, how they're connected to each other. And I also talk with them about what their area of concerns are. Oftentimes we go into the home and the family has one concern. They may only be concerned about a child's language development. And during the course of the assessment to determine eligibility, we find out that there are other concerns based on the testing or assessment as well. And so I give the family the opportunity to really ask questions so that we can explain what we saw during that process. And then I let them know that we know what their concerns are, and I share with them that based on eligibility, that's not how we determine services, that we're always going to determine services based on the most appropriate needs of the child, and that we're still going to focus on what their concerns are, and that's where we're going to meet them at, but that we're also going to support them in the child's other area of development as well, because we're looking at the entire child. We're looking at the whole child, and we want to make sure that the entire child and family, that they're healthy. So I think it's important for us to make sure that they understand all areas of development and how they're connected. And we really give the families the opportunity to ask a lot of questions so that when we leave, that they're clear about what concerns we're going to be addressing as well.
Thanks, Joshua. And yeah, I definitely think that, like I've been guilty of before, just kind of getting caught up in, not really, or just taking for granted the fact that parents don't always know how development is really so intertwined and how we look at everything in more of a global perspective. So thanks for sharing that kind of piece. Katie, how do you feel as a parent hearing that your child has delays in other areas?
It's definitely hard to hear, and it's not, I knew he has delays. Like, I know he has delays, and it was helpful that I had an older son, but it's never easy to hear that your child's not doing something well. But, when you have a child with a disability, you see so many specialists all the time. And the specialist or doctors never have anything positive to say. They never say, oh, he's so cute, look at his little hands. It's always, this is wrong, this is wrong, this is what you need to work on. Why, oh, he's not doing this yet? Well, that's because he has this and this. So it's always hard because you never hear anything positive. Everybody's glass is always half empty. However, when you have somebody that comes into your house and they say, well, this is it, this is where he is, he does have some delays, but just because he has a delay does not mean he's not going to get to that milestone. It just means that he may take a little longer to get there. There were times when I didn't think he'd be able to sit unsupported. There are times when I didn't think he would be able to crawl. There's times when I didn't feel like he'd be able to bring his hand to his mouth to eat a Cheeto. And I'll tell you, when he did those small, what some people may take for granted, when he did those small little developmental steps, I almost jumped out of my own skin. It was better than Christmas morning. I was so ecstatic, and it was so great to see the coordinators and therapists celebrate those small gains with me because they knew how important of a developmental milestone it was. So it's great having the supportive team around you to remind you, yes, on paper this is going to look like a delay, but it doesn't mean he's not going to meet that goal. It just means it may take a little extra time. In the grand scheme of things, when a child's 25, what does it matter? It's harder as they're younger because you see it and there's so many more developmental milestones that need to be met.
Thanks, Katie. Yeah, and before we kind of were talking about like how hard it is having these conversations with families and whether or not like we are choosing, to share this information with families based on whether or not we think that the family can kind of handle it or not, or if the family is really just seems too overwhelmed and maybe they're not ready for it. And you kind of, said that it would be hard, right? But you would rather for them to be honest. Can you kind of talk a little bit about that?
Absolutely. Honesty is always the best approach. And when you have somebody that's not honest with you and you can tell they're not being honest with you, it's going to be harder to trust them down the line. Now, yes, when they do tell you, I've had therapists say, Katie, he's not going to walk anytime soon. Come on now. It's going to take years. Yes, that's stung. Yes, my heart dropped. However, that person was being honest. And when I looked at it, a couple weeks later, or even a day later, or even hours later after I had a chance to go to my car and cry and go get a Starbucks to calm down, I had more respect for that person because they were honest with me and straightforward than I would have if somebody was afraid to tell me something. And parents, come on, we're people too. We can tell when somebody is beating around the bush and not wanting to tell us something that they think. And we can, like Leah said earlier, nonverbal body language is stronger than verbal, so we can read those signs too.
Thanks, Katie, so much, just for sharing that with us. So let's kind of look at the assessment for service planning and the IFSP development, because this is really a time that everybody kind of identified is really a harder time for us to share information. And really it's because we're reviewing the child's strengths, kind of what you talked about, but we're also talking about their areas of growth. We're talking about their child outcome statement, so how they compare to other peers their age, and we're talking about their developmental ages. So Katie, how did you experience this process, and how did this feel to you as a mother kind of going through it?
It was hard. It was really, really hard. So when my son was assessed, he was my main problem. The reason he was in the NICU for so long is because he couldn't coordinate suck-free swallow, and he had a very hard time drinking a bottle without having bradycardia. We work with a speech therapist every day. That's the only person we work with, and she was a godsend. It was great. When we got out and we were assessed, I was told that he only needed PT. And I was kind of shocked because I'm like, well, no, we were in the NICU for so long because of speech. He needs speech and feeding primarily. And they're like, well, we're only going to do PT for now. And I'm like, but that's not, like, he's not working on anything PT related. He's not even doing anything, to my knowledge. To my knowledge, a PT was you break your arm, you break your leg, you need physical therapy, or you have an unstable gait, you may need physical therapy. Nothing to do with feeding or swallowing. I didn't think at that point, I'm a parent, not a professional in this field. Anything to do with coordination of swallowing and sucking and breathing. So it was a little disconcerting to me that they were only recommending PT at the time when I was really wanting him to be able to take a bottle properly.
Yeah, and I think, we probably take for granted where they're coming from the NICU and what was the main focus in the NICU too. And that's probably why it's really so important for us to really find out what the parents' concerns and priorities are and really make sure that we're listening to them and we're validating them and that we're addressing them as well. So thank you so much for sharing that. And I think you kind of already shared about being honest in this kind of situation too. And this whole process, it can be really intense for all of us because we're sharing so much information at once with families. I used to always feel like, especially in the beginning, I would hide information but it was really more because I felt bad for the families, or I felt like I wanted to protect them, or it was my own feelings, and that's what I realized, and that's why I really appreciate what you said, Leah, before about really understanding that it's your own feelings. And then, once I had kids too, and for those that know me, I have a buttload, I have like 5, but once I had kids and I went through the process of taking my children to the doctor, I always think, too, I'm like, especially now, like my 5-year-old, he's going through different testing to find things out. And I'm like, just tell me what's going on. I want an answer. I want to know. And so just being honest with me, that's the reason that I'm here, even though it's going to suck and it's really hard to hear that information, but I do want to know it. So I definitely just really appreciate, Katie, like all of this insight that you're kind of giving us through this process. So let's look at ongoing assessment. And this is really what's occurring between IFSP development and discharge, right? And Katie, I know as we talked before, you really brought up resources, that was something that was important to you. So I really just wanted to kind of give you time to really talk a little bit more about that.
I think anything that you can provide the family with at any time that's going to benefit them in an individualized fashion speaks volumes. I was looking for so many different resources, and you know, I didn't have a lot of resources because my son didn't really fall into a category because he didn't have Down syndrome or autism or, you know, even CP. So I was I felt like alone on the raft. So I was open to as many resources as I could have. And I'm one of those people that flood me with resources, and I'll sift through and I'll research and I'll find if I would benefit from them or if my child would benefit from them. So it's really important, and I think that'll help form more of a bond and relationship if you can provide the family with more outside support.
Thanks. And you said before to me, and I thought it was something like really powerful, so I just kind of wanted to bring it up again, but you said to really revisit the resources kind of throughout the process, because there's times that maybe we're sharing resources with a family that they're feeling overwhelmed. So you kind of want to expand a little bit?
So I know when I initially heard of his diagnosis, and they would throw out words, and I would just Google the words, but then it's like my brain was not processing anything. I had too much going on. And so they were like, well, check this out, you know, check out this resource. And I felt bad because I had to keep coming back and saying, okay, what was that you told me again? Like, what was that? So it's okay to, if you tell the parent something in the very early stages and you think they're at a point now where they're willing to listen a little more or take in more information, and you still think they would benefit from it, to bring it up again, because more than likely the parent just had so much going on that they couldn't, there's a whole different processing speed that goes on as you travel further down this path.
You gotta love Dr. Google. I think we're all guilty of that. Well, so
exactly.
Another piece of ongoing assessment that tends to come up, and it comes up in other times too, but it could be if a child scores as a risk factor on the MCAT. And so, Jessica, this is really where I thought that you had some great thoughts on for things just for us to kind of remember when we are referring children to some type of clinic. Can you share this information with us?
Sure. Thank you, Lisa. So our locality is lucky enough to have our own autism clinic strictly for early intervention families. So I know that's unique and not all localities have that, but I think these tips are important to remember when referring a child to anybody else that would give that possible diagnosis, as well as any other diagnosis that might be needed to be looked at further. So, and I know lately there's been pressure to refer a child that is showing signs of autism who scored high on the MCAT, with the data surrounding how important it is to diagnose early, especially to get services. But there are things that I think are important to keep in mind when suggesting this referral. So the first one is, what does the family know about autism spectrum disorder? So with the high prevalence of ASD or autism spectrum disorder, the diagnosis, many people have heard of it before, but it is imperative to help educate the family on what it really means and not assume that they know what it means. So, and that we found that many people might think, or they think of the child with the severe autism diagnosis, and so that can be pretty scary. And so I think it's important to educate that there's now a spectrum of diagnostic characteristics, and so it's hard to predict where the child will be on the spectrum, and I think that can be the scariest part. Also, has hearing or vision concerns been ruled out? Many times this is recommended on the initial IFSP to rule out, but a lot of times it can be forgotten about, or, you know, like Katie was talking about, there's a lot of information going in at that point when the IFSP is written. So we don't want to diagnose a child with autism when there is an actual hearing loss that has not been ruled out. And number 3, so are the parents concerned? So this is important to check on to see if the family is prepared to hear about this potential diagnosis, as well as how invested they may be to follow through with the clinic or referral process. So we have had families state that they want to go through the process, but then back out last minute because they want to wait to see if their child makes any progress. And this is okay, but we don't want to pressure the families that they need to hurry up and seek a diagnosis. And then number 4, how has the family been with EI strategies or early intervention strategies? This is important to ask with follow-up questions such as, when has a child first been referred to EI? What is the child's environment like? Has he or she had the opportunities to engage with others? How often is the child engaged with technology? And has the child experienced trauma? So, these are just some questions to kind of keep in the back of their mind when you're looking at a child for ongoing assessment. There are a few children, that I've seen it come in with high score on the MChat, but then they've been able to develop new skills through coaching and modeling for the family. And there are also children that score high in the MChat as a result of trauma that they have experienced. So that's also important to keep in mind. And lastly, what is the driving reason behind the referral? Again, this will speak to follow through with the clinic and if the family is prepared for the potential diagnosis, but also what is the family needing assistance with? Are they needing help in the home environment due to the behaviors of the child? And so we tend to ask this one when we're trying to prioritize who we bring into the clinic, but it's also good to see what their expectations might be for what they want to access once they have that diagnosis. For example, a lot of children are referred to ABA therapy, and it is an intense therapy, and it's not covered by most insurances, so it would be helpful to make sure that the family is aware of this when it's recommended. And as with any resource, if you are helping to refer a family to it, it is good to really know what that resource entails, because I think it can be a little harmful to refer a family to a resource but not really be aware of that process. So I think it's important to keep that in mind.
Thanks, Jessica. And you also really just had some really great tips of following through, and I think the way that you guys had a great way in your clinic, how they're utilizing you too. So I just wanted to give you an opportunity to kind of share that information with everyone on what happened, after they received that kind of difficult news.
Mm-hmm. Yeah, no problem. I'm also a social worker that can be put on the plan as a service. So for our clinic, the process is we sit down with the family and have a discussion, and so they know before they leave the clinic if the child has a diagnosis of autism or not. And I know other clinics are that way, or other professionals are that way. So I think with what Katie mentioned, there's a lot of things that can be coming at the family, and when they receive a difficult diagnosis or a fact that their child has delays. So I think it's a good opportunity to kind of see if they're prepared to receive more information about what the next steps are for a child that has a diagnosis. So in looking at with that, we offer a one-time visit for me to come out afterwards after the child is diagnosed. And so I know not all localities have a social worker, but this could also be done with another provider or with the service coordinator, whichever would be most important or most pertinent for that family. And so I think it's just important to check in rather than avoiding the discussion. I know we've mentioned before that body language and, they can tell if that's being avoided, and that strategies can be reviewed and how to continue to help that child achieve a goal. And the diagnosis may not change the approach as the goal that's written in, and so it could be a good time to go over that with the family. And it may be they're processing the diagnosis and how it's going to impact them as a family. And it's not just the immediate family that it could impact. It can also be a concern culturally or with extended family members. They could be processing in their head how to tell other people in the family. So the family may be preoccupied with their thoughts. It could be just running all over the place. And so it can be helpful to kind of assist them in the present moment and bring them back to developing a plan for the future, and to tell them that you're on this journey with them, and give them space needed to process it. And a lot of times I hear they cried, we need to put you on the plan, but it's okay if they cry. I think you don't have to solve it right there and right then. I think they just might need you to be with them in the moment and just sit with them and reassure them that they're not alone. And look over the report with them. And answer any questions. If the report doesn't come from your practice, that's fine. Just read it with them and review it with them while you're there. And if you don't know the answers to their questions, just let them know that you're going to find out the answer, or suggest that they call and ask that question of the practice that gave the report, and ask if they need more support. So sometimes, like Katie mentioned, you might need to tell them more than once about a resource. Sometimes in that moment, I just sit down there and make that phone call with them to help with the wording that they need to request that referral or that resource. And so I think that's important. And one thing I wanted to put out there is that CA, which is, it used to be Commonwealth Autism, but they have an awesome resource finder page that's for the whole state of Virginia. And they want to offer services for other than Commonwealth Autism, or other than just autism services. So they actually have resources on there for a lot of different areas of need.
Great. Thank you, Jessica, so much for sharing that information with us. I imagine it can be hard sometimes going through that process with families. So I forgot to mention, Jeannie just posted the tips handout. So it has different tips for each of the process as we kind of go through it that you can kind of refer back to later. And the final process that we're going to talk about is transition. So transition really begins at the beginning of early intervention. And there's a lot of information and a lot of unknown variables when we're discussing with the families. So let's go ahead and take a look at that. So Casey, you had a really great analogy when we were talking about transition, so we kind of put this visual up for you. Can you share that with us?
Yeah, so I think if you don't start talking about transition soon enough to a lot of families, it feels like they're being pushed off a cliff. We provide so much support in early intervention, and if there isn't a great transition plan in place, it's kind of like they stumbled out of our program, and what's next?
Thanks, Casey. Yeah, and it can be really just a scary process, I think, for families, not really knowing what's going to happen. And it's something that tends to sneak up on us. I always felt like that, even as a service coordinator, that time just snuck up on me, and it was already time to transition them. But I guess time sneaks up on all of us, right? So let's look at the different ways that a child transitions. So as you can see in this visual, there are multiple ways that a child can go through transition. So Josherlon, how can we help families really feel grounded in this type of transition wherever they go?
Well, we know that each family is going to transition from early intervention in some way. And for some families and service coordinators, it's going to be a really easy conversation. They've met all of their goals, they're age appropriate, and they're going to be moving on. And then for those families who we know are going to have a road that may be a little more difficult, or they're going to always need some type of services or support, that conversation is not so cut and dry. And so we really need to start talking about transition from the beginning, so that we can make sure that families know that we're going to support them, so that we can start giving really good resources, talking about child care, the community resources that's out there, talking about any type of outpatient therapy, and then talking about Part B, and really letting families know from the beginning what some of their, what some of the resources and kind of which way they're going to be able to go. And we know Part B can sometimes it could be a longer process. So we really want to start to prepare families for that, and to go back to what everyone else is saying, is to really be honest with families so that we can help them figure out what's going to be best for them. And so if we start talking about it at intake, which we should be, and just letting them know that they will transition, and let them know that we're going to be a part of their journey, and we're going to be helping them to find out what's going to be the best fit for them once their child leaves early intervention. So we talk a lot about eligibility and ASP and ongoing services, but we want to remember that transition is really an important conversation, and we don't want to begin to have it at the last minute. We want to touch on it throughout every step of early intervention.
Thanks, Josherlon. As just kind of hearing you guys really just talk about things throughout the process, it just really points out how preparation is such a huge part, preparing families for the steps in the process, preparing families for the information that's coming to them. Casey, you also kind of go through transitions with families. Is there anything that you would suggest or you would like to add?
I think adding on to what Jen Sherlin said, another important piece is really offering to go with those families and visit the programs. I've gone with them to daycares, to outpatient, and if you feel like you don't have the time, maybe it snuck up on you or the child just didn't have much time in therapy, using that coaching model and really helping the family realize that they can take a friend or a relative or go on their own and visit these programs to see what's going to be a best fit for their child, and then taking the time to follow up with them afterwards to see what they liked, they didn't like, and help brainstorm as needed.
Thanks. I also love the idea that you shared about seeing if there's somebody else that could go with them too, because we all have different people in our lives that we don't always think that may visit with us, like a friend or cousin or somebody. So this really brings us to the end where I want to give you guys an opportunity to ask the panel any kind of questions that you would like. So go ahead and start typing any questions that you have into the chat box. While you're typing, I just wanted to let you know the date for the next Talks on Tuesday on June 4th, 2019. Dr. John Harrington, he is going to provide just some medical updates on what's going on with autism. Dr. John Harrington, he is a pediatrician over at CHKD in Norfolk, Virginia. And he also has a child who has autism. So he has a lot of great insight and a lot of passion about this topic. So please save the date to join us there. And I'm going to go ahead and look back and see if you guys have any questions, if you want to type. And while you're doing that as well, just to let you know that you should receive a link in your email to complete a survey, and then you'll have access to the certificate. And I just really want to thank our panel, each of them, just for coordinating this with us and joining us. I know it took a lot of time and a lot of effort to get us to this point, but thank you all so much for doing this for us. Fairfax asks, Jessica, where is your autism team based out of?
We're the Henrico area.
Okay. So in Henrico.
Mm-hmm.
Central, you said, did you have something you wanted to add?
That was fun. I just wanted to say that conversations, they're going to be really difficult sometimes, but families are going to be really grateful for our honesty and the support and resources that we've given them in the long run. They'll be grateful for those things.
Yes, thank you. That is such a good point. Yeah. Katie, I don't think you said it today, but you did say something before. You said something about a doctor saying something a year from now that you may not feel.
Yeah. Yes, that was the best advice. I know I always forget what I said in the past. Sorry about that. That was really good. The best advice I got was a doctor came up to me and said, a year from now, this will not seem as bad as it is right now. And at that moment, I was like, yeah, right. This is horrible. This is hard. And a year from now, time heals all wounds. You hear that all the time. But it was the best advice because my life, it became a lot easier. And I sound really negative, but I'm not really negative, but it's really
you really offer such a great perspective, and like how it is a difficult. Like we have to acknowledge that this is difficult. It's difficult for everyone. The family, it's difficult for us, too, and that's really I think what Leah's part one was about, and so that's why I would really encourage everybody to tune in there. So it doesn't look like we have any other questions. So thank you everyone so much for participating and joining us today. Oh, and Jeannie, thank you for posting that. Jeannie just posted the April Talks on Tuesday. Thank you all.